This is Naija Health Education Series. Theme: Eye Care 360 with Dr. Tenman Pamshak Elisha. Raising an informed healthcare community, empowering you with the right information required for making informed healthcare choices. Powered by DAP TV Nigeria with support from Friends of Good Health. Naija Health Education Series. Raising informed healthcare community.
I'm Dr. Tenman Pamshak Elisha again, here to discuss about issues that get to affect our children's eyes. Our interest for today will be to look into the components of an eye problem referred to as childhood glaucoma. So, as we know, glaucoma can affect adults. Glaucoma as well can affect children. Children can be given birth to from day one with glaucoma. And what do we say a child has glaucoma? So based on the definition of glaucoma by the Glaucoma Research Network, they define childhood glaucoma as the presence of an elevated intraocular pressure greater than 21 millimeters of mercury. Now, intraocular pressure has a normal range of between 10 to 21 millimeters of mercury. But when it goes beyond 21 millimeters of mercury, it means that it is higher than normal, and then it's an indication of a possible glaucoma in the eye of that patient. They have also gone to define glaucoma in children by the presence of glaucomatous changes, where you have the cupping or the thinning of the part of the eye that we refer to as the optic disc, and then you are having a variation in the two eyes of about 0.2 or more. So when you have this increased cupping, when you have variation in the discs, then is a possible pointer to the presence of glaucoma in a child. Then they also define glaucoma with the presence of cornea changes. So when you have an enlargement of the cornea, that the cornea looks bigger than normal. So you have increase in the cornea diameter. For newborns, when they have cornea diameter that's greater than 11 millimeters, it's an indication of glaucoma. When you have cornea diameter of 12 millimeters in individuals that are within 1 year of age, is indicative of glaucoma. When you have glaucoma, cornea diameter that is 13 greater, or equal to 13 millimeters at any age of the child, then it's a cornea change that is indicative of glaucoma. Also, the presence of what we call herpes striae. Herpes striae are white lines that we see on the cornea of the child. So that is also an indication that this eye is likely to have glaucoma. It also defines glaucoma with the presence of visual field changes. When you have visual field changes that are in agreement with visual changes seen in glaucoma, then it's indicative of glaucoma in these children. And they also defined it with the presence of progressive myopia. So we just discussed myopia a few times back. So when you have progressive myopia, that is a child having to be coming to the hospital almost like every 6 months or every 1 year and telling you that the glass you just made for me yesterday, I'm no longer seeing it. I can't see things that are far again. I can't do my far walk. This glass is no longer useful to me. Then cross-check, this child might be having glaucoma. So all these features that we mentioned, when you have two or more of these features occurring in a child, then this child is likely to be suffering from a childhood glaucoma. The child needs to be looked into very well, evaluated properly, and then see how much we can help this child. Childhood glaucomas can be defined as either primary childhood glaucomas or secondary childhood glaucomas. Primary childhood glaucomas occur with the changes that get to happen during the process of development, during the birth process of the child. There are some developmental channels for drainage of the fluid in the eye. We call it aqueous humor, that is not adequately established. This could now result into the development of glaucoma in these children. Secondary glaucomas can occur when you have possibilities of trauma to the eye, when you have history of surgeries in the eyes, when you have the presence of other syndromes or other diseases in the eye of the child. Now, this could result into what we call the secondary glaucomas for these children. Now, what are the symptoms that the child with glaucoma could get to present with for children with childhood glaucomas? So, majorly, children with childhood glaucomas tend to present with complaints of tearing, photophobia. That is, you get to see the child, a 1-month-old child being given birth to, child gets to be having excessive tearing. Child doesn't want to see light. When you shine light, they want to close the eye, and then they get to have blepharospasms. They get to squeeze the eyelids whenever light is being shown to the eyes. So those could be features of congenital glaucoma. Now you get to see a child that is still growing. Then a child is having very big eyeballs. The eyeballs are protruding. They are looking bigger than normal. Those could also be features of childhood glaucoma in that child. Then you also get to see that the child is complaining of having blurry vision. He's not able to see things that are far away from them very well. Now, these are also features of glaucoma in these children. When there is a history of trauma to the eye, someone had hit the eye of this child, or this child has had a previous cataract surgery before, or any other surgery that was done that went into the eye, then this child can come down with glaucoma. Or when the child has some allergic problems, and then instead of parents coming to the hospital to get adequate treatment, they decided to go to pharmacies around and then just bought eye medications, steroids to be specific. Now, these steroids are drugs that should only be prescribed to you by eye care personnel, because of the fact that when you use them uncontrollably, they have the chances of resulting into causing glaucoma in these children. So we tend to encourage people to avoid those medications as much as possible without the doctor's prescription. When there is a family history of glaucoma, when a father or a mother has glaucoma, there's a high chance that these children that they will be giving birth to, some of them could get to come down with glaucoma as well. So once there's a risk factor of glaucoma in a parent, then we need to ensure that the eyes of these children are being checked regularly. And then other systemic diseases can also get to result into the development of childhood glaucoma in these children. Now, let's not also forget that glaucoma itself is the commonest cause of irreversible blindness. Now, unlike cataract, that is the commonest cause of reversible blindness, glaucoma could result into irreversible blindness. However, we have the ability to prevent you from getting blind as a result of glaucoma, but we cannot do anything to reverse the blindness in a child if it has occurred already as a result of glaucoma. So how do we, or what can we do to prevent you from getting blind as a result of glaucoma? It's that for every child that is being given birth to, we encourage that the eyes of this child should be looked into by an eye care personnel. When we look into the eye of this child, we'll be able to know whether this eye is having glaucoma or not, and whether there is a need for us to follow up this eye regularly or not. Okay, so when you do that, you're going to help us to be able to help the children. Now, when a child is being seen to have glaucoma, we tend to prescribe medications for the child. But before we even get to that level, now when you bring this child to the hospital, we're going to do a thorough examination on this child. So we're going to examine this child, we're going to look at the eye, we're going to shine light to the eye, look at the size of the cornea. Okay, we're also going to do an examination for these children under anesthesia. When we do that under anesthesia, we get full and maximum cooperation of the children. And when we're doing this examination, what are we looking at? We're going to measure the size of the cornea to make sure that it doesn't get to those measurements we're talking about. We're going to measure the pressure in the eye to make sure that the pressure is not higher than the value that we talked about. We don't want the pressure to be higher than 21 millimeters of mercury. Okay, now we are also going to look at the angles of the eye to make sure that either the angles of these eyes are open or closed. What is it that is causing this glaucoma in this child? If the child's angles are not well developed, then we offer interventions that will be able to help. Okay, Now we're also going to look at the back of the eye of the child, which is referred to as the retina, to be sure that there are no other diseases at the back of the eye that are possibly predisposing this child to developing this childhood glaucoma. Okay, so when we now check this child and then we've made our evaluations and we've seen everything, then for children, when you start intervention for childhood glaucoma early, you tend to achieve reversal, because the damage that would have occurred to the optic nerve behind, we know the optic nerve is part of the eye which has neurons. So it's described, or you can illustrate it with the use of electric cable. Electric cable has so many wires in it. So these wires are being covered by the plastic rubber at the back. All right. So when you have these wires, so the normal eye has about 1.2 million of these wires. So, but in the presence of glaucoma, when the pressure is high, the pressure hits on the back of the eye. When this pressure hits on the back of the eye, it damages these neurons and then it reduces their number. So when their numbers begins to reduce, then the level of clarity of vision that the person will have begins to reduce. So they begin to have blurred vision. Okay. So when you have these wires in the cable, once you begin to remove some wires from the cable, it tells you that the strength or the quality of current that will pass through this cable will be reduced, and therefore some appliances might not get powered as expected. Okay, so same thing happens in glaucoma. When these neurons begin to reduce, the level of clarity of vision that these patients will have will begin to reduce, and then clarity will be affected because the things that should carry light from outside through the wires to the brain are not doing the work that they're supposed to do effectively because of the fact that glaucoma has affected them. So, but the joy of this is that in children, with early intervention, there is a reversal of this damage. But in adults, once this damage has occurred, it's a damage for life. So there are certain things that can change when we have successful intervention for childhood glaucomas in children, like the reversal of the damage of the optic nerve itself, and then the overstretching of the sclera itself can also get to bounce back. But the enlargement of the cornea cannot be reversed in these children, even with successful intervention. So what are these interventions that we can offer to these children that will help them to have improved vision, that will help them to have better self-esteem, that will make them not to go blind, but then to achieve their full potentials? So we can offer eye drops. Medications can be given to these children. When you come and meet your eye care personnel, first intervention we get to do is to provide them with eye drops. When we provide these eye drops, what will these eye drops do? These eye drops help to reduce the pressure, help to reduce the production of this HS humor, and then as they reduce the pressure in the eye, it increases the clarity of the cornea. Because when the pressure is high in the eye, you begin to see the cornea of the child tends to look hazy. And when the cornea is hazy, it means that it has absorbed fluid. And when it absorbs fluid, it means that light cannot pass through it properly. So you need to give them medications that will reduce the production of this fluid in the eye, that will as well reduce the pressure in the eye. When this is reduced, clarity of the cornea is achieved, clarity of vision is achieved, and the child gets to see better. However, in most of these children, giving these eye drops alone does not solve the problem in its entirety. What these eye drops tends to do when we give is that it just gives us an interim intervention. It helps us to prevent the blindness that would have occurred because of the high pressure. It helps us to control, helps us to buy time while we work towards giving them the definitive intervention or treatment. And what is the definitive intervention for these patients? Majorly, we offer them surgeries. We offer them surgeries. What are the surgeries? We offer them surgeries that will help us to provide an alternate pathway where this excess fluid in the eye will now be drained out of the eye. And when this excess fluid in the eye is drained out of the eye, pressure is not so much in the eye, pressure is not so much built up in the eye, the nerve is not damaged, the sclera is not stretched, the cornea is not stretched, and therefore vision gets to be maintained or preserved in these children. Now, there are different kinds of surgeries that we can offer for these children. We can offer surgeries at the level of the angles. We can offer surgeries above the level of the angles. So it depends on the type of childhood glaucoma they have. We take the decision on which of the surgical approach to do. So we can do a goniotomy where we operate at the angle level. We can do a trabeculoplasty. We can do a trabeculectomy where we create a fistula, or we create an alternate opening where excess fluid gets to be drained out of the eye. We can offer them shunt surgeries where we use a tube, passing the tube into the eyes, and this tube now helps us to drain this excess fluid in the eyes. Okay, we can even offer them some lasers. Laser surgeries can also be done for them, which will help us in controlling this pressure in the eye. So, however, for these children, offering the surgery itself is not the final bus stop. Once a child is said to have glaucoma, this child becomes our patient for life. We follow up these patients for life. We modify intervention as time goes on. As we review these children, as we see them, we take the next call. Okay, so because of the fact that the doctor has told you that, okay, we've done surgery, pressure is controlled, everything is fine, it doesn't mean that you should disappear from your follow-ups. You need to maintain your regular follow-ups so that when you come for these follow-ups, we see the eyes and then we tell you that, okay, this is the stage that we are, this is what we need to do. Because even after the surgical interventions, there are times that when we check the vision, we might need to do a refraction. And when we do refraction, we might need to offer the child glasses, depending on the kind of refractive error that might have occurred as a result of the glaucoma that they have. Some of them can even develop cataracts. So when these children develop the cataracts from the glaucoma itself or from the intervention of the glaucoma, we may still now have to go ahead and also get to offer them cataract surgery so that the vision in the eye will still be maintained and then it will still be clear for them. Okay, so we need to follow up these children regularly, and then we take the next call as situations permit, and then we get to carry you along. So this is to help so that you get to understand what these interventions are all about, what we need to do for these children, what we don't need to do for these children, so that you are being carried along. We get your maximum cooperation so that the children will get to live their destined life with clear vision and then with full vision. So congenital glaucoma or childhood glaucoma, it's an emergency for us. It's something that we need to intervene as quickly as possible without so much delays so that we can get to prevent damages to the optic nerve fibers so that our children can get to enjoy the fullest of their vision from childhood all the way into their adulthood. Thank you for listening to us today. Once again, it's Dr. Tanmang Panshakilesha, your consultant, pediatric ophthalmologist. Thank you.
This is Naija Health Education Series. Theme: Eye Care 360 with Dr. Tenman Pamshak-Elisha. Raising an informed healthcare community, empowering you with the right information required for making informed healthcare choices. Powered by DAP TV Nigeria with support from Friends of Good Health. Naija Health Education Series. Raising informed healthcare community.